For nearly 60 years, Meals on Wheels of Central Maryland has been known for, well, serving meals.
But they are taking their care to the next level now, teaming up with Johns Hopkins to extend care for participants. And WMAR 2 News' Abby Isaacs joins us right now to explain how the new program is actually a win-win-win.
It is. It's called the Together in Care program, and it just started this year as a pilot program with Meals on Wheels of Central Maryland. Now, for Meals on Wheels, the partnership with Johns Hopkins presents a new and critical funding source for their programs. For Johns Hopkins, it means intervening with patients to keep them at home and not having to make frequent hospital visits. And for the patients, well, I'll just let Miss Deborah Wagner from Dundalk explain that one. Every other day, Miss Deborah Wagner gets a visit from Meals on Wheels.
This stuff is really good. I was a picky eater, and I'm not so picky anymore.
Her new normal after getting released from the hospital in April.
Let's do a survey.
Are you experiencing any new pain, any unexpected pain?
No, nothing new.
Okay, that's good.
She's part of the new Together in Care program with Johns Hopkins Bayview, Meals on Wheels America, and Meals on Wheels of Central Maryland.
We're perpetually trying to enhance the impact we have in people's lives.
It's changed everything for me. I haven't fallen since I've been back home from, I haven't fallen.
And that's huge for Miss Wagner. She says since November, she's been taking bad falls around her home.
The one time I fell over like a dead tree in a forest. I mean, and I'm thinking, how am I going to get up from this?
As part of the program, she got a free home assessment where they installed new fixtures to prevent falls and improve her mobility.
This is much safer.
Yeah, you just grab and you pull up, yeah.
Pull up.
And while they deliver food, Meals on Wheels employees conduct daily surveys to make sure she's doing okay.
Did you take your medicine today?
Yes, I did.
And you have all the medicine that you need?
Yes,
Good.
I have all my medication.
Johns Hopkins Bayview Dr. Panagis Galiatsatos says these are the things they usually can't oversee, but have a huge impact on patients' well-being.
But this is what 21st century medicine should be, to help our patients out in the community, to keep them from coming in and out of the hospital and keep you home, right? Here, safe and sound.
Now they can reach the otherwise unreachable.
The ones who need it the most, because of the so many barriers that exist out in the community, unfortunately, this is how we get to them. We go to them.
I've been reached.
I've been reached. Perfect. That's a great way to put it.
Not only does this help the patients and Johns Hopkins, but the partnership helps with the funding crisis for Meals on Wheels programs across the nation.
We really hope that we can continue to see that hospitals not only should have relationships with Meals on Wheels, but should be incentivized to pay for the Meals on Wheels because it really helps the entire healthcare system as a whole.
An entire healthcare system that Ms. Wagner says now has her back.
Great. I never imagined it to be so great. I was thinking, these people are going to invade me. I'm not going to, I'm not an individual anymore. There's so many people surrounding me that I never had before. And now I got a whole new family.
Now, right now, they have 40 people enrolled, and they hope to serve 100 in just this first year. Meals on Wheels America hopes to replicate this in other areas across the country after this pilot program.
Well,
What a great program.
You made Deborah's night, I'll tell you. How can more people get involved?
So right now, it's just with patients at Johns Hopkins Bayview. You have to be at least 60 years old and have a serious chronic medical condition, and there's an intake specialist to find those different patients. And then, on the other side, there's always need for volunteers with Meals on Wheels, and they'll be expanding next year to other hospitals, hopefully, to get even more patients.
Meals, 60 years, right? 60 years they've been around.
60 years this year.
I'm looking for 60 more patients. So.
All right. Thank you, Abby.
Yeah.